So Olga also has pictures, so we can.
Oh, okay, excellent.
Yeah, so
sure.
just midway during our
You let
conversation,
us know. Yeah.
we can, just ask her to share her pictures.
Yeah.
And I'm very advanced Zoom user, so that you know. I just share my screen, right? Or
Yeah. You just click on that share screen option, and it's better if you open the pictures beforehand, like open them right now, so that when you click on share screen, that tab will be visible to you, and then you can just click on it.
Okay, good. Yeah, perfect.
Where are you currently, Olga?
Me. I'm in the Netherlands.
Oh, you're in the Netherlands. And Marianna, you're in Poland?
I am in Romania.
Oh, you're Romania. Okay,
Romania.
fine. Not it was Poland. Okay, so Romania and Netherlands. That's amazing. That's great. And we're in Karachi, by the way. It's hot. It is hot.
So
maybe we
here.
could give them a view of but afterwards, I guess.
Yeah, we'll show you our view. We're on the 10th floor.
Once we're done with because the setup is right now, the camera is looking at us right now. So we do a 360 degrees of the space where we're sitting. So you'll get a good view of downstairs as well from here.
Nice. So what's the temperature right now?
35? 37.
37.
That's still bearable,
It
right?
is good. Yeah, actually. It in the peak during the peak summer days or afternoons, it can get up to 40, 41,
40 plus.
40 plus.
Yeah.
Is it cold there?
Relatively.
Relatively.
Yeah. I mean, Romania is somewhere like closer to the south part of Europe. So usually we don't have like a cold winters, and we have a very long, this spring and autumn period, which is very nice. Yeah, but only probably in August we have like plus 40.
Netherlands is a bit extreme to that because we start to have plus 40 in the summers as well. But that's really not the right temperature for here, because right now it's about 8 Celsius, which is okay for this time of the year. It can get up to 12, 15 maybe this time of the year, but yeah, way colder.
Yeah, but
that's winter for us.
Yeah. Sorry, Marianna.
For myself, I mentioned that it's very difficult to focus when it's super hot outside. For me, it's like colder, it's more productive, more efficient work. So it's I'm more of the north person.
That's why you live in Romania. Yeah. I
mean, when it's too cold, it's also difficult to focus because you're freezing all the time, like minus 30, minus 40. It's already like extreme.
Oh my God.
Yeah, I won't be able to function. I'll just hibernate.
When it's minus 40?
When it's like, I don't know, even if it's 10.
You can get used to it. I think a couple of seasons, and then it's just all about layering. So
yeah, there is a Finnish saying, so from Finland, like there is no bad weather, it's just bad clothes. You need to know how to dress yourself.
That's a great point. That is true.
All right, it's 3. Should we start?
Yeah, let's start. Let's get going.
All right. So good afternoon, everyone. Assalamu alaikum, and welcome to our guests who are listening and our panelists. My name is Marianna. We welcome you today to today's episode of Medjack webinars. The chapter we've chosen today is called Chapter 8 of our book, Medjack. The chapter is called Text Linked to Innovation. A bit about the book. So the book Medjack is AKU's first ebook, digital book. Print copies of it are also available. The book has been co-authored by a total of 14 co-authors, and it's available on Amazon and this platform in Pakistan known as Kobo. We decided to have these webinars because we wanted to invite people from all over the globe and provide them with a chance to share their journey, their personal journey around innovation, creativity, and entrepreneurship. Today, we're honored to have representatives from Health Tech Without Borders. It's a global nonprofit organization that leverages digital tools and technology to provide immediate access to health resources during humanitarian emergencies. Founded in 2022, this innovative hub connects companies offering digital tools with medical and psychological experts to provide digital health interventions, such as online consultations, remote monitoring, and digital therapeutics. Health Tech Without Borders also offers online trainings for clinicians in crisis areas and provides vetted digital health tools. The organization is working with corporations, universities, governing agencies, and other institutions around the globe to bring health, hope, and healthcare efficiently to local communities affected by crisis. Now, without further ado, I'm going to introduce our guests for today's session. We have with us Marianna Petrea, a digital health expert with over 2 decades of experience in the tech industry. She is the founder of Health Tech Without Borders, the introduction of which I just gave. Marianna has extensive experience in emergency deployment for various types of disasters and is proficient in telehealth, AI, ML, and big data. She has a talent for building international, multidisciplinary, and multicultural teams and is skilled in investigating, allocating, and utilizing different types of resources. We're excited to have you here. Thank you for agreeing to be our speaker, Marianna.
Thank you for having us. Very nice to meet you.
And I'll introduce our second speaker for today, Olga Gershuni. She draws inspiration from research, education, and nursing. She has a wealth of experience working as a medical assistant, registered nurse, and a surgical assistant, specializing in patients from diverse backgrounds, socioeconomic statuses, and health conditions. Her expertise also extends to educational activities, including core nursing modules, nursing leadership, internship coordination, and supervision of young healthcare professionals, as well as thesis coordination and examination. Her research interests encompass a broad range of health-related domains, including public health workforce development, health literacy, and AMR, ABR, as well as action research. So good to have you here today. Thank you so much for agreeing to be our speaker for today's webinar.
Thank you very much.
And now I'd like to introduce the moderator for today's session. We have with us Dr. Asad Mia, former chair of emergency medicine, professor and director of CCIT, Critical Creative Innovative Thinking Hub at AKU. Good to have you here, Dr. Asad. How are you feeling?
Good. Thank you. I'm on call. Still on call, actually.
Okay, you're dedicated. Most sure. So over to you, Dr. Asad.
All right, great. Thank you. Thank you, Marine, for introducing our panelists for today and for giving the audience a rundown of what CCIT, well, not so much what CCIT does, which we don't have the time for that, but at least the book and why have we been doing these webinars. Now, this is the third year of our webinars. It's V3.0 of Medjack webinars. And every year we've kind of had really interesting guest speakers and panelists, and this year is no different. So we're really excited to have Marianna and Olga as our panelists today. And the way we were connected to them is also a very interesting story. And I don't know if the folks know, but Varda Rafaqat, who used to be a medical student at AKU, who's currently working, doing a research assistantship or fellowship, I believe, at Harvard, at Mass General. She had reached out, and she's working with Jaron, and Jaron is working with Shuhan, and then that's, so there's no looking back. So that's how Marianna got roped into this particular interaction, and Marianna then roped Olga into this as well. So it's really interesting how we'll be talking a lot about health tech without borders, and here's these connections without borders as well, right? So people that you get to know and how you connect ahead, and stories, innovation storytelling is what we're the gist of all of this is really innovation-based storytelling. We want both Marianna and Olga to tell us about their journeys through innovation. Obviously, we won't have the time to delve into each and every point, and we'll try to get you back towards a theme of sorts so that we could also look at the end of this 1 hour, what else could we be doing in the future as well, right? So it doesn't become just a one-off webinar. So I just wanted to kind of lay out the direction or the sequence of events, if I may, so that we also think about the future, that we continue to work together, continue to have these conversations, and so on and so forth. So with that long preamble, let's start off with Marianna. So Marianna, we like a few weeks back, I think, or maybe it was about a month ago, that we had a fireside chat, which is our way of a meet and greet. And Marianna and Shuhan were online with us. And so from that time till now, I think we've got to know each other better. We've got to know much more about Health Tech Without Borders. But Marianna, I would like to kind of get you to reflect on your personal journey, right? So you've had this extensive period of more than 12 years in conventional business, where breakthrough innovations tend to be few and far apart. I think it's not something you just kind of routinely come across. And then you pivoted perhaps into the healthcare industry, and you founded Health Tech Without Borders. And you switched towards product-based innovation that was specific to healthcare. So what was that about?
What happened?
What happened exactly? What happened? And could you just, maybe condense all of that into like, bite-sized kind of an answer for us as well? Thank you.
Okay. So, yeah, I think I'm a good example of this life-long learning, which is very kind of a modern term right now, because I'm in my second career, let's say. I am in tech from the very beginning. I finished university on cybernetics. So basically, I did technology all my life. But yes, indeed, I did some IP telephony. I worked for Xerox Corporation, which is, very good, let's say, business school for all the leaders in American side and both also in Europe. And then I decided to switch to healthcare, which is absolutely another industry, and moreover, to keep doing and keep working with technologies. And it required from my side, personally, quite a good plan of learning. And I'm very thankful to all opportunities which platforms like Coursera and others give to all students around the world, doesn't matter of the age. And this is also what we are doing right now with Health Tech Without Borders Academy, that we have the access to the knowledge, we have the access to experience, to experts. And moreover, you can somehow combine your learning experience, both from theoretical side, but also with the practical exercises with something else. And this is how I actually grew by myself, this knowledge base. Yeah, I also finished the Stanford University in healthcare specialization, which helped me to understand this piece of technologies or digital health domain for healthcare systems. So this is kind of my way of thinking about how you can start from basically zero, knowing only technologies and having the technical background, and switch to the industry so complicated and so complex like healthcare. And this is what we usually inspire and try to give the advices to students, how to actually build this learning pathway, because there is actually even the terms, the learning time or learning pathway, when you can plan how you can reach the certain level of knowledge. It's perfectly if you can also practice on the way. And this is, I think, what I receive from my experience in healthcare, Health Tech Without Borders, as NGO implementing all the time technologies in the ground, in the fields. This is practical side of what technologies are in healthcare today. So this is my answer, how I reached this point.
Thank you. That was thank you so much for condensing it. And it was really, it is really inspirational, sounds really inspirational. And how you've managed to kind of like do all of these different things and merge them. And that's a very creative process in and of itself. Tell us a bit more about your background. So you're Romanian and you're currently in Romania, and then you went to
So
the US for training. Yeah.
Yes, I live in Romania with my family, and actually this, how to say, the interesting side of Health Tech Without Borders, that 95% of people who work in Health Tech Without Borders never met in life. So, for example, Olga is my close friend. She's my close colleague, and we went together, and we're going through the very complicated projects, including the mental health support. And thanks to Olga, that she actually initiated the mental health project inside the Health Tech Without Borders. And it was a bit, difficult for me to jump inside this topic because I don't have any psychological or I'm not psychiatrist, not psychologist. I don't have mental worker background. But she had the courage, which she shared with me, that we should start to do this. And then Eva Skinner-Regel joined us. She is a real expert in our, let's say, triangle. Yes, so there are many things which we explore on the way, not being even like physically together, which is quite challenging, taking into account that we are spread it a lot between the countries. So the big part of health tech is in United States. We also have Hisham. He is one of the founders of health tech. He is in Switzerland. We also never met. But this doesn't matter if you have a common goal, and if you are quite disciplined, you can really work together. And this is what we also share as our experience, that even chatting, you can move the projects quite well, because disaster response requires really be responsive, be responsible, and be quite quick, and be structural, be actionable, something this way. And probably that's why people somehow, naturally gathered together in health tech, being this way of human beings. Yeah. So that's why it's quite easy for us to work together. We quite good in understanding each other. We trust each other, because trust is one of the, the main background and soul for this type of work, which is mainly virtual.
Great. So thank you for kind of introducing Olga and bringing Olga into the conversation as well. So Olga, I'll just go to you now. And so you're Director for Nursing and for Mental Health Programming at Health Tech Without Borders. So tell us, based on your experience, what are some of the tools that have worked when it comes to tackling mental health care issues, especially with healthcare providers? What do they require? What's your experience been like that in that particular domain? And I think that's given the fact that it's a very high pressure domain, it's a high pressure area. And so especially with disasters occurring, what has been your experience, and what kind of tools would you recommend that people should consider as well?
Thank you so much. And also thank you so much for introducing me and bringing me into this conversation. So basically, I have started the opposite of Marianna. I have started in healthcare, and then I kind of switched to technology, or at least added the technological aspect to my career. So, of course, the technology plays a crucial role in that. But if we talk about mental health support, there is a human factor which is necessary there. So when the initiative regarding mental health has started within Health Tech Without Borders, we needed to understand the contextual aspects of the support which is required. So without that, without the cultural knowledge, the contextual alignment, it was quite difficult to address the mental health needs for the providers. So we started as anybody else in these fields. We wanted to gather some knowledge experts just to provide the guidance, the knowledge transfer to the psychologist, well, in this case, based in Ukraine, because this is where we started with our mental health support activities. But then we kind of soon realized that our mental health workers, psychologists, psychiatrists working with population, with damaged population, they are damaged themselves. So they need this kind of support, which is crucial for them to maintain their well-being, their health, but also their resilience as well, which is definitely needed in such conditions. So that's where we started. We wanted to understand what are the needs of people we want to support. So we reached out to them. We wanted to understand what are the current situation where they need support. And because they were all professionals, we needed to be also careful with our knowledge transfer, because eventually it was them who provided us the transfer of this knowledge, because such conditions are quite unique as well. So we wanted to build up on what is needed, what is known, but also what is crucial for their well-being. And this is how we started our mental health initiative, Help the Healer Heal. So this is although it's a digital component which is integrated in there, it does require the human component. So we wanted to provide, at first place, the communication with the psychologists, in the way which would be safe for them, trusted, but also when we were able to, just to communicate with them. So this is how we started to that regard, and we are continuing with our activities. Also, recently, we have started our mental health activities in Turkey after the earthquake. So this is where the mental health support is also provided to the clinicians. It's a different disaster, obviously. It's not a war. It's
natural disaster.
Exactly, but it's still a disaster. So the way how people going through that is still devastating. And also another initiative, it's how we support our nursing and paramedic students. So this is how we also would like to support our future workforce to carry on with their activities. Because, for example, the nursing turnover is a huge problem worldwide. But given the fact that, for example, there is a war somewhere and people are just fleeing, there are also a lot of nurses in any country are females. So they're the first people who would like to save their children, and they just find a safer place and they live in the field. So this turnover is kind of made more difficult for our workforce to carry on with their activities. So that's why we want to support the future workforce to build their resilience and to be more strong, in order so they would be able to continue providing health to population.
Great. So thank you so much for that, Olga. And so just to kind of recap, right? So what I find really intriguing and really fascinating is that, Marianna, you are a techie who's gone into healthcare or healthcare tech, and you got Olga, who trained in nursing, is going into health tech. Well, Health Tech Without Borders is this melting pot, perhaps bringing different people from different backgrounds, irrespective of what your background is, and it seems to be a very collaborative, open kind of a place that is allowing these kinds of linkages and partnerships to prosper as well. Would that be a reasonable assumption, Marianna and Olga?
Yes, I hope so.
Absolutely, yes.
I hope that we are proving this by everyday work. And yes, the multidisciplinary approach is one of, let's say, our strongest side, because we have a very strong medical advisory board. And also on the technology side, we have a great group and great advisors. And somehow, you know, it's impossible to implement anything in healthcare. I don't believe in this without clinicians, medical professionals, nurses to be involved. Yeah, and of course, it's also a patient-centric approach. And when tech side, let's say, thinks and believes that they can do everything alone, they will stay alone with their solutions at the end of the day. So yes, so that's why, and it's so interesting and so valuable when you receive the feedback from your colleagues. And we're trying every time when we make assessment of different technologies to really find a very high level of experts in the exact field, either it's pediatrics or cardiovascular diseases or something else, just to understand if the application of this solution is good, it's needed, it's comfortable to work. Because the specific of disaster response implementation is that it should be very fast, basically.
Right.
So yeah, so the room or time frame for implementation is very short. So that's why when we make assessment, even in advance, when some companies make application to us for the assessment for disaster response or humanitarian crisis, we should take it into account. That's why every time we ask, what is the workflow of the implementation? How you think it can be fast deployed in the area? And of course, what Olga mentioned as well, that we started in Ukraine mental health support, and we moved to Turkey. And we're also trying to find different places, including the, you know, countries where everything is fine, but just to share our experience, like European Union or WHO, just to explain that disaster response is a bit extreme, let's say implementation or example, but it's very valuable because it's very kind of painful process. Yeah, so even when we move one program from one country to another country, we should make first the assessment of the country. So we cannot just copy paste the same things, because for Ukraine it was a specific approach. We had a language barrier, and in Turkey we had to limit ourselves only with English language, unfortunately, because we didn't have the Turkish speaking mental health professionals. So every time it's something like a very specific things which we should take into account, but this is a plan of assessment of every place of implementation.
So this is really interesting. It's really important that you're mentioning these points, because some of the questions that we had for you were about the challenges that you come across, and you are mentioning some of those challenges. And I wouldn't want the audience to kind of take away from our just a very limited 1 hour or less than that session. Disaster medicine and emergency medicine responses, it's a huge area, it's a huge field.
It's huge.
And we can just skim over the surface in this, but we're trying to kind of establish these connections with Olga and Marianna through Health Tech Without Borders, so that we can continue these conversations. So just one question that I had as a follow-up for both of you is that if people from Pakistan, maybe students, because students tend to be very driven, and whenever there's a disaster, whether and Pakistan is no stranger to disaster. Every year we have disasters of our own, and so even if there's international something happening globally, how can students, let's say from Pakistan, how can they be involved? Could they volunteer through Health Tech Without Borders, for example?
Yes, of course. I mean, we always have like the open door for all volunteers. Yeah, so it's kind of the process which is like all the time going, but from time to time we have like call to action, like we had for Philippines in April. And yes, for the previous year floods in Pakistan, it was a series of online courses available also for medical professionals and for citizens, civilians, about the water, about the like different aspects which population should know in this type of disaster, and we keep recording this content. Yeah. Another thing is that you're absolutely right mentioning that digital natives are more responsive, they're faster. I mean, they're younger, they have more energy, they have more ideas. And that's why one of the, let's say, our actions is the Healthcare Without Borders Academy, when we transfer our experience to, first of all, medical students, yeah, and also volunteers, just to expose them to the idea that what potentially could be done in the setup of the disasters. So it can be some technological response, it can be some ideas with, again, online education. I don't know, if you want to make TikTok videos, you know, digital natives, they have their own tools which they are comfortable with, yeah. And we actually learn a lot from our medical students, and not only students, but also we have high school students. We have even 14, 15 years old volunteers, and some of them programming, some of them doing different things. So we are absolutely open. Some of them help us a lot with, like Vanessa and Brent and Anna, they help a lot us with the social media. So, I mean, there are many fields where students can have more brilliant ideas even than we have. So that's why it's really important for them to be involved and to feel that they experience is needed.
Yeah. Completely agree. So thank you for that. So just as a note, like if there's students on this in this webinar, so if you're interested, just reach out to us and we can connect you to Marianna and Olga, and then we can keep disseminating that information about, you know, students who are interested in volunteering and they have different skill sets. Then it doesn't matter. They don't have to feel restricted that they have to be medical or nursing students only to
Yeah,
participate
absolutely.
in
We
something
had pharmacists, we had dentists, we had like hospital management, future hospital management. So all types of students, and it's let's say more important for them to understand that if you know your country, if you want to serve to your community, and if you have some ideas about some digital solutions or just even simple actions like to inform the citizens, to help them, you can all the time gather this. And from our courses, I think that they just keep this in mind, that if something will happen, then knowledge should help them how to really be prepared and to help their community to go through this challenge.
Great. So quick question for Olga. So Olga, tell us a bit about your background. So you're from the Netherlands, and you trained over there. Did you also travel elsewhere for further training, and that's how you came across Marianna, or how was that connection made?
Yeah, that's we had an amazing connection, to be honest, 1 year ago. But just to start from the beginning, no, I am actually Ukrainian born, and I live in Netherlands for almost, well, not almost, for 16 years right now. It's April, so I moved here in April 2008. So yes, I have a nursing background. So I actually I started in my medical career, let's just say 20 years ago, as ambulance worker. I was a student at that time, and I was pursuing my education to be a paramedic, a medical assistant. And then I worked for some time as a surgery assistant, also in Ukraine. And then after I moved to Netherlands, I was continue working in the medical field, although the alignment, contextual alignment, this is what we're saying actually here, was quite challenging because it was different for me. So I had to restudy. I had to do my extra education, and then I also finalized my master's degree here in Netherlands. And right now I'm also finalizing my PhD in public health workforce support. And then, then a year ago, I reached out to Healthcare Without Borders. And then it's just the same what you were saying about the students. I was also very hesitant to reach out because I thought, how can I contribute? Although now I'm thinking, of course, everybody should be able to contribute. But anyways, in the beginning, I was quite hesitant. What would be my contribution to this common goal. And that's how I reached out to, well, I just pushed the button, I want to help. And this is how it started for me. But I mean, nowadays, and Marianna already mentioned that we have a very close collaboration, and the borders doesn't really matter. That's the thing. So we know each other's strengths. We know how can we work together, and we're driven and passionate about what we do, and that's what makes us strong.
Yes, great, fabulous. Thank you for telling us about the past journey of yours. And I'd love to get to Ukraine, but like in a minute or so. I don't know if there are people who have any questions or comments. They can put them in the chat box, and we can take a pause and we can ask the question of our speakers, panelists.
We can ask Olga to share her pictures. She has
Oh yeah,
exciting
Olga,
pictures.
you have pictures as well. So please feel free to share those pictures. Let me get this one question out though, because I wanted to connect chapter 8 of Medjack now, because that chapter does talk about techs linked to innovation. And so we've been talking about emergency medicine, disaster medicine, these kinds of responses, whether in a conflict zone, war zone, or in a earthquake or flooding or whatnot. So there's all kinds of technological advancements and innovations, AI, machine learning, data science. We've got EHR and so on and so forth, right? And the list keeps growing and it gets more and more confusing. But having said all of that, based on your experience through Health Tech Without Borders, and based on your reading of the chapter, what are some of the innovations, maybe one or two innovations that for you are really cutting edge, where disaster medicine and response to that, to disasters is concerned? Is there something that stands out for you, or maybe nothing stands out for you? It could be either. And the question is open to both of you.
Okay, I can start because I would say that, of course, telehealth, and now we are very close to the launch of our chatbot, which was created together with Microsoft for the tactical medical response. And I'm a very practical person, so I answer only on the questions which I implemented by myself. And I can guarantee the 100% that they work. So of course, I mean, what we probably need in disaster response, and this is really vital and absolutely visible, that coordination, this, let's say, supply and demand, this is how we call it in business. So when one region needs something and another regions can supply, and other countries can supply it with healthcare for workforces, with equipment, with medicines, with technologies. Of course, this part should be done better, because the example of Ukraine, for example, it wasn't so well coordinated in the very beginning. Probably it was much better later. But of course, all of us, we passed through the pandemic, and we know that we are stronger when we are together somehow. Probably not all regions, all of them together, but somehow understanding that we can help each other. And the example of Turkey is also just recent and very visible, that yes, we know what is earthquake, we know what is the region, but we still cannot size it well. So we cannot predict and forecast what actually should be done. And this is a very big part of the success in response from my perspective, again. And I wouldn't, put again like the 100% true on my side, because I'm also quite new in disaster response field and only on the technology part. So we have Dr. Lee, one of our founders, and he is doing disaster response all the time. So he probably will have his own perspective on this topic. But yes, the coordination, the planning, the forecasting, the resource measurement, the utilizing of resources, and coordination between NGOs and other organizations. And of course, what is really critical is the recipient side. Yeah, so if you have a good partners on the ground, like we have in Ukraine, and we are building in other regions, that's also very important to make let's say the entire process easier and faster. So
great, thanks. Olga, would you like to add?
Yes, thank you. Well, basically, you know, as I already told you, I'm also a practical person, but not merely from the tech side. So I'm really user. So that's what Marianna just mentioned. In the end of the day, a disaster response is everybody's responsibility. So we can't be sure that it's only medical professional who should be able to respond adequately. So from my perspective, I like to see all these technological applications, possibilities, and just to test them, how is that user friendly in terms of the immediate action. So it's not like, I don't think that I have a good example, a part of the chatbot that Marianna just has mentioned, because we had tested that from various perspectives, and that's necessary. It's something, you know, we have so much technological possibilities nowadays. It's numerous. You can just Google it, and then you have plenty of them, which are basically also quite good rated as well. But who are those developers, and who is the intended audience for them to be used? How is that evaluated? What's the other side, the pitfalls of the usage of such applications? So from my perspective, I definitely think that for all intended users, there should be everybody available just to test it, give a proper feedback, and adapt it so it would be really responsive to a disaster in this case.
Yeah, and with this we are coming also to the process of, you know, testing, validation, vetting, and checking for certification, and it's valid for both medical workforce and for technologies. So basically what we did while implementing the telehealth in Ukraine, we did it in parallel. So we had 800 volunteers, medical professionals from around the world, and we had unfortunately manually checked them one by one if they have enough, you know, credentials. And then I will pass to Olga, because she wrote amazing work about the different requirements in different countries, and this is absolutely great experience. And from the other side, the second part was the big work with checking all the telehealth solutions, platforms which applied to the call to action. And this is really interesting but challenging work if you want to do it in 2 weeks or 1 week. So and this is a very specific thing for disaster response. But if you are already, now we are in the stage when we can plan something and we can actually think in advance, okay, we will need this type of technology. Of course, that would be great to have some small EHR system in this region available for African countries, for example. And we would like to have, I don't know, teleradiology, and we should check radiologists for this purpose. Then you can do it in advance and not to be so tense under such a big pressure. And Olga, could you please share with us the outcomes of your work with credentialing?
Yeah. So that's been quite some work that I was interested in, is the credentialing regulation in public health workforce. But of course, there are some examples of application of telemedicine or digital health within public health. So what are the requirements? Because there are so many. The credentials, the requirements for that, and regulation and registration is different. For example, even only in US is state specific. So it's quite difficult to have some kind of alignment. So how can we be sure that people who would like to be involved as a volunteers in such cases, when we talk about disaster response, how can we check them? What is the important aspects of being credentialed or being certified within certain field? Because then you're delivering only healthcare by means of digital health. So how should you be credentialed? Should you have any credentials? Should you be licensed? So those challenges are unfortunately unsolved yet, but still we do have these components which are crucial to be taken into account, such as educational backgrounds, hours of the specialization, these kind of things. And of course, lifelong learning, as Marianna just mentioned, is also one of the components which should be involved when we talk about the credential regulation in any areas of digital health.
Great. So there's a lot more to discuss in this, but I'm cognizant of time as well. So Olga, you'd like to show us some photographs or some slideshow?
Yes, definitely. So let me check whether it's visible. I think it is, right? And
yes.
Can I also? Okay, so I think I have to do it one by one. Yeah, so this was one of the initiatives we have in nursing school in Ukraine, where we had some the starting seminar or a lecture of the importance of higher education, and then also let me also check something else. My apologies. I am really user of of Zoom.
Check if it's on slideshow mode, and you can just move on to the next slide.
I think it was not. I think it was not. So let me just stop sharing screen. I think, do I? Or do you still see something? I think.
We were. Now we don't.
She needs to share it
No,
again.
no. Yeah, I will share it again. So maybe that would be just easier. So here we have, my apologies.
It's all right.
So I think now you can see that, right? So this is the container that we have, we helped to get installed in Ukraine. So this is basically just a building container, or let's just say in Amsterdam, students live in such containers. So of course there are windows and such. So it was fully equipped container with laptops, with tables. So in order to ensure the educational needs of students in the region, because of the lack of electricity and internet connection, they were not able to carry on with the educational activities. And it's just actually what we have mentioned in the beginning. The retention is already high. So how can we ensure that future workforce would be stimulated and motivated to carry on in order to complete the education and serve in terms of health delivery? So this is one of the initiatives we had. So I think I'll just stop sharing.
Okay, great. Thank you. We have questions. Yeah, let's move on to a few questions.
We do have a couple. Okay, so Iman Rashid's saying her question is, she wants you to tell her about the difficulties you faced when you began the Tech Mental Health Initiative. And then secondly, how do you plan to address the varying mental health requirements of different regions across the globe in relation to disaster management?
Yeah, it's definitely a wonderful question. So let me start, and maybe Marianna, you can continue or add something from your side and perspective. So the difficulties, there were many. First of all, was the contextual alignment, just what I have mentioned. So it's quite difficult because sometimes you're hesitant to reach out to people, and people are also hesitant to respond to that, because as a mental health professional, you are supposed to be strong. So But we kind of made it quite open for anybody, and we just made sure that we are there for them to be talked to. So the active listening was one of the major parts. Another difficulty was, of course, reaching out to providers, because when we started reaching out to them, it was a horrible situation. It was just the beginning. So they were busy. They were having, I don't know how many hours a day work consultation with their patients. So they could not find that much time for us to, just to be supported by us. And on the other hand, of course, we had this internet connection problem difficulties, which is quite unique, because you never think that's something like that going to happen, but it was the case. So, for example, meetings were scheduled, but people were not able to connect simply because of the internet connection. So yeah, that was quite challenging. And then on the other hand, the second question was the requirements, right, in various regions in terms of disaster management. So well, mental health requirements, of course, would be quite on one hand different, and on the other hand quite the same, regardless the disaster, because we would like to make sure that we have this cultural components involved. So when we would like to provide some mental health support, we need to make sure that we're on the same level and on the same page with people who are supposed to receive this mental health support. So that would require the needs assessment from our side. I think I can stop here, because I think
so.
maybe
Marianna, were you going to add something?
Yes, I think so. So, of course, what Olga mentioned, in Ukraine, we had to, first of all, find people who speak either Ukrainian or Russian language, because the local psychologists and psychiatrists don't speak so widely. Some of them speak really English, but it was very difficult for them to express their feelings and their thoughts. For Turkey, we had to go only with English language, but there are certain similarities when people work in disaster zones. So the moral distress, the first signs of mental health issues, they are not so different, I would say. Again, I'm not a mental health professional. I'm just like learning on the way together with my colleagues in Healthcare Without Borders. That's why when the earthquake in Turkey happened, the first action which we made a recording for the first responders. So how to identify what is happening with you, how to think about yourself, how to make a self-assessment, because you really can. It's really difficult to understand if you don't know and you don't somehow check yourself very carefully, if you are physically exhausted, or that's emotional trauma, or it's already the mental distress or something else. So even I myself, I'm learning for actually my own good, because I also should have some coping mechanism, because when you work repeatedly in different zones and you're listening to these stories and you are in close contact with people from these regions, it's even in conversation, it's conversationally, it's difficult to be all the time, responsive in your good shape. And this is what we require from ourselves, to be focused and to really respond in the best possible way. And this is what we share with medical professionals and with all responders, because, in Turkey, there were also engineers. So many other professionals are helping to solve this. And so this is the first step about this kind of self-assessment. like thinking about yourself, looking around, also peer-to-peer support, because you are surrounded by your colleagues and you can help them to support each other. Even, you know, this one of the programs we made for the students in Ukraine, because, you know, this is a young generation, and the specific of educational program is that nursing students can be 17, 18 years old. They're teenagers. They are not even, let's say, adults. Yeah, and probably tomorrow they will have to go to the front line. And this is really challenging for 17, 18 years old kids. And this is how we try to teach them and share the knowledge that you can be supportive to your close circle, to your close community of co-workers, let's say. And you can identify if something wrong is happening, then you will have a tools, or you can at least, you know, mention this, put the sign, okay, it's not going well. We need to request the help from the mental health professionals. And yes, so basically helping healers heal is that you receive this support from professionals who really help people working in ICU units, working in disaster response. So they're very experienced in identifying these signs of mental health issues.
Just to add a couple of things on that, what Marianna just said. For example, yesterday we had a meeting with a group of midwives from the same school, because we have several, well, let's just say focus groups, the paramedics, nurses, midwives, and we kind of were thinking, okay, so how to start? But we should not be afraid of starting from the beginning, from the very basic, although we have an assumption that those people, they were older, they are supposed to know certain things, but somehow, given the stress, the high level of stress, they just don't think about that at all. And for example, yesterday we were talking about the sleep hygiene, and that's something, you know, you would never expect to think about that this information is needed, but it was. In the end of our group discussion, students really told us that it was very valuable for them just to rethink about certain things, certain behaviors which might be dangerous or harmful for them. So we should be able, and you should be able, everybody should be able just to provide some low threshold examples, so people will really understand, okay, how can they really be supported on what field, and then questions would arise. And of course, the technology is a huge part of the support. But first thing is first is definitely something that's they have to receive these human components in it as well. So it's not only technology in this case, but also the human.
I'm sure, Asad, you had your own story, how you cope with this you know, difficult moments in your career, in your professional life. And unfortunately, it's not still a part of the educational program for medical students. So they spend a lot of many hours on different disciplines, but nobody is teaching them how to cope with the first death of your patient.
Yeah.
And this is...
Sorry, go ahead.
Yeah, and this is what I think is very traumatic in the medical professional's job. Yeah, that's why many people, like, you are going to this profession, you are going to the field of healthcare with all the best wishes and hopes and wishing to help you and support your community, but then the first trauma, and you cannot just overcome it. Yeah. And yeah, it should be somebody knowledgeable, and you should learn it by yourself and to help others to go for this.
Yeah, that's a great point, Marianna. And thank you, both of you, Olga and Marianna, for mentioning these points. And it's interesting that because we're running out of time, but based on the questions that were asked, which were like two questions really, but there's another question, but the importance of mental health in disaster scenarios. And Marianna, when you asked me about my experience of working with patients, I haven't been in a disaster setting. I mean, I've been in cities where there have been disasters. I recall when I was working in the US. I was training in the US, and when the hurricane, what was it, Katrina. So I was
so
in
many names. Every year a new one.
Katrina,
Yes.
that was the one that I was and was most familiar with, because from Louisiana, New Orleans, and then patients, or people who had to evacuate, then made their way to Houston. And I was training in Houston at that time, so I wasn't directly involved. But disaster medicine and disaster responses, that aside, when you're just working in an emergency department, one-to-one interactions with your patient, even there's trauma right there. When you know that you might not be able to do much for your patient. So, and we're not trained as healthcare professionals, as a doctor, and Marianna probably would agree with me as well, that we are simply not trained in how do we approach trauma of this kind, and we tend to internalize it. Most of the time, we just don't know how to process it. And so, but now that we're talking more and more about mental health issues and how do we deal with these things, and disasters becoming more and more frequent, they will not become less frequent. I think this has to be made part of the medical school curriculum or the nursing school curriculum, and so on and so forth. So perhaps that could be one of the take homes from this
Yes,
session.
absolutely.
And so I think I'd like to link this session to the next session that we'll have in May, which will Shohan's actually going to be our speaker, and perhaps one or two more from his team would become panelists. And if you could be part of that as well, at least be there in the audience, and maybe we could, it'll be in continuation, because we will continue talking about disaster responses. We haven't figured out what the outline will be for that session, but I think it'll be a good follow-up for this particular session, and we can keep talking about similar themes as well through this. But over to Marianna to wrap up.
Thank you for that, Asit. I really enjoyed today's session and the discussion around heal the healer, because that really touched a nerve, especially with me, because in med school, even during training, they will teach you how to suture or how to, give treatment or manage a certain condition. But then how do you cope up with whatever you've seen and then intensify or make it 10x or 20x when you're actually in the field? When there's no, proper ER room or facility too, right? So then how do you cope up with whatever you're seeing, all that trauma that you, as Asit said, you end up internalizing? So I think that's food for thought, right? Right there for us. So heal the healer. I'm going to leave it at that note. I really liked it. Thank you, Asit, for moderating today's session. Thank you so much, Olga and Marianna, for giving us such insightful answers to our questions, and for letting our audience know that there exists a program such as Health Tech Without Borders, and you don't need to be a tech expert or a healthcare provider to want to help people in need.
Yeah.
So
I also wanted to thank you for inviting us, and I wanted to add actually one interesting point. So we implemented telehealth in Ukraine and mental health programs without any funding. So it was only pure volunteering work. So many people, like we had 800 volunteers, we have tech companies, they donated their hours, and this is what we actually every time repeatedly asking people and companies and medical professionals, please donate your hours, please donate your knowledge, please donate your expert understanding. And 1 hour of your expert knowledge is more valuable than, I don't know, thousands of dollars. Sometimes it can solve a lot of issues more than money. So that's really our call to action, like all the time. So, and we hope that more companies will join this movement and thinking about how they can apply their technologies to healthcare and humanitarian crisis and help other people, either donating some free licenses or free access to regions, or translating to the local languages. It's not so expensive. but it can help really many people. And in some moments, it's really crucial and yeah, will help people to survive.
Great point.
Thank you. We'll keep that in mind, especially for our upcoming course OTBT. I think that would be a great
Yeah, actually, that's right.
Avenue for students. So we do have a course coming up where a lot of medical students will be in touch with us, and we'll make sure to spread the word of Health Tech Without Borders if there's a chance that they can help.
Yeah. Thank you so much.
Thank you so much. And Assad, Marine, thank you so much for having us. And of course, dear audience, thank you for listening to us.
Yeah, thank you for your time.
Thank you.
Thank you.
All right. Thank you all.
Thank you,
have
and
a
a
nice
very Eid, happy Eid Mubarak. Is
Oh,
that
yeah.
the thing? Happy
Eid
Mubarak.
Mubarak.
Thank you.
Mubarak to our viewers.
Thank you.
Thank you.
Bye-bye.
Have a great day.
Bye.
Bye.
Bye.